More than 3 years into the pandemic, and we're in a much different place than we were. Over 100 million cases later, transmission of cases has been falling. Much of the restrictions made at the start of the pandemic have just gone away. In just over 3 weeks from today, America will no longer be under a COVID-19 public health emergency for the first time since January of 2020. But what will that mean and what does it look like? Abby Larico verifies.
Over the course of the next month, you may be seeing ads and posts urging you to get your COVID-related treatments like vaccines and at-home tests before they're harder to get. So will access to tests, vaccines, and treatment change after the COVID-19 public health emergency ends on May 11th? We checked with these sources to verify. Let's start with COVID tests. Once the public health emergency ends, access to free at-home tests will end for people with traditional Medicare. Medicare will still pay for tests administered by a doctor, like PCR lab tests, but there could be a cost for the doctor's visit itself. Private insurance and Medicare Advantage will also no longer be required to provide any free testing, be it at home or with a doctor, though some might continue to do so. As for vaccines and antiviral drugs like Paxlovid, access going forward isn't tied to the public health emergency. Instead, it's all about supply. The federal government has a stockpile of vaccines and antivirals. Those federal resources are free to anyone, regardless of insurance status. But numbers are limited, and ongoing access relies on federal funding that Congress hasn't provided.
The main issue will be for people without health insurance.
So for vaccines and antivirals, access will continue in the near term, but unless the government makes new policy, costs might increase once federal supplies run out. So we can verify that yes, access to COVID tests, vaccines, and treatment will change in the near future, but not just because of the public health emergency ending. With your Verify, I'm Abby Larico.
If you're looking to stock up on some COVID-19 tests now, you can get some from the state of North Carolina shipped to your home for free. Now, you can order these free tests once a month through June 30th from the Project Access COVID-19 Test Program. They're available while supplies last. But remember, if you're getting these tests now for later, they do have an expiration date. You're going to want to check to make sure any at-home COVID test you use is not expired before you use it, because it could result in inaccurate results. Now, as for the vaccine, U.S. regulators approved yet another dose of the Pfizer or Moderna shots for older Americans and people with weakened immune systems. Folks 65 and older can get their next booster as long as it's been at least 4 months since their first dose of the bivalent booster. Immune-compromised people only need to wait 2 months after their first shot. Now, as for the future of COVID-19 boosters for all the rest of us, the FDA is meeting in June to discuss the possibility of a yearly fall dose. If you're among the 60% of Americans who never had COVID, or you've had COVID but haven't experienced any long-term symptoms, it's still important to get vaccinated and stay up to date on those vaccines. A new study finds the severity of what's known as long COVID now occurring in about 1/3 of survivors. Depends on how you experienced your initial illness.
3 years since her initial COVID infection, Sarah Bursma still has lingering symptoms.
Sometimes things don't smell at all or taste at all, and sometimes there's things that I'm smelling that aren't even there.
The mom of 3 also has bouts of fatigue and is more prone to respiratory illness.
I just have to watch it and be very careful and treat myself a different way than I used to.
Researchers at the Northwestern Medicine Neuro COVID-19 Clinic followed 600 long haulers. They found symptoms differ depending on the severity of the patient's COVID infection and whether they were hospitalized.
We saw that those patients who were previously hospitalized with severe pneumonia perform worse in tasks of processing speed, attention, and working memory.
More than 80% of patients in the study experienced brain fog, 70% had headaches, and more than half lost their sense of taste and smell. Bursma trained and ran in the Chicago Marathon last year, but believes her long COVID is here for the long run.
Do you anticipate having symptoms for even longer?
I, at this point, feel like what I have is not going to go away.
Bursma says she's grateful to feel mostly back to herself and has a new perspective on her health.
Well, the study found other common long COVID symptoms included dizziness, insomnia, depression, or anxiety.